NAMI is an organization, we're the Connecticut chapter, there's a chapter in all 50 states, and we're an organization that basically is involved in three different areas. One is support, in the form of support groups for both caregivers, friends, family members, parents of people with mental health concerns, as well as support groups for people who are in recovery from a mental health condition, whether you're a young adult, just an adult of any age, or a veteran. We have different recovery groups for those three demographics. We also do education classes, both for, again, caregivers and the general public, as well as professionals, school systems, as well as social workers, nurses. We've talked to a lot of different organizations over the years, colleges, etc., just trying to get people to understand the dynamics that are involved when a person has a mental health concern. Because believe it or not, in a lot of places, the education that the professionals get is all focused on the individual with the illness, but not at all on the family and its impact on the family, and how the family can actually be a real great resource in helping the person with the illness enter into a meaningful recovery. Conversely, if the family is excluded, it can be another problem you have to deal with. So we teach people how to best integrate the family into the care team, which is really important. Last but certainly not least is our legislative advocacy arm. We are extremely active both at a national level down in Washington, D.C., where our national headquarters is, but also within any given state. The NAMI office is typically located right in the city where the state capitol is, here in Hartford. We're in Hartford because we're up at the state capitol on a regular basis. We lobby on behalf of people as well as caregivers for better mental health services and better funding for the services that are provided. We also fight against discrimination. So if someone floats a bill that would be discriminatory against someone with a mental health condition, we're up there banging the drum to get that defeated, and we've had a lot of success over the years. And in fact, it's funny, there's a particular bill that seems to surface every year around housing discrimination, and it's like, no, that's a clear violation of the American with Disabilities Act and HIPAA and fair housing laws, but yet for whatever reason, some legislator always thinks it's a good idea to introduce a bill that would prohibit people from having a place to go, a group home or what have you, and we always fight against things like that every year.